In the past decade, the controversial issue of legalizing euthanasia has been a topic of debate around the world. Euthanasia is the painless killing of a patient suffering from an incurable and painful disease or in an irreversible coma. The common belief by many is that euthanasia is a good way for a patient to end their suffering. They believe that patients should be given the option to end their life if the pain is too much to bear. By focusing on the suffering the patients face, opposers overlook the deeper problem of how easily it could get out of hand. Take Belgium, for example. Belgium's parliament passed a bill that legalized euthanasia in 2008. Since then, the country has experienced some staggering statistics regarding this form of assisted suicide. In the last year alone, cases of euthanasia have increased 27% in 1 year from 1,432 reported cases to 1,816 cases. And this is only from reported cases. A recent study in Flanders reported that 47% of all euthanasia cases are not reported. If the rate of euthanasia increased by this much in 1 year, imagine the long-term effects legalizing it would cause. Another study in Flanders found that some euthanasia deaths are carried out without the consent of the patient. Giving euthanasia to the patient with no consent is no different from murder. The results of Belgium's decision to legalize euthanasia serves as an example of how easily legalized assisted suicide can get out of hand. This isn't the only reason. Many patients who are in a lot of pain suffer from depression. This depression can cloud the judgment of the patient. David Williams, a father of 3 from Cardiff, is a survivor from spinal cancer. In terrible pain and fearful of the distress he was causing his family, Williams stated that if euthanasia was available, he would have taken it. He now says that he was depressed by his illness, which may have caused him to want euthanasia. Williams' wife contracted liver cancer and died a few years after his recovery. Had he opted for suicide, he points out, his children would have been orphaned. Williams' experience goes to show that in many cases, patients may consider euthanasia because they are suffering from depression, which clouds their judgment. These patients make decisions that are irrational, and they may fail to see the reasons why they still need to live. As the atrocities of euthanasia begin to surface, many supporters begin to change their views of legalizing assisted suicide. Professor Theo Boer was once an advocate of legalizing euthanasia, but as he monitored the legalization of euthanasia in the Netherlands, he changed his mind. He stated that the very existence of a euthanasia law turns assisted suicide from a last resort into a normal procedure. Boer cites that ever since the Netherlands legalized euthanasia in 2008, there has been a 50% increase of assisted deaths every year. To add to the matter, Boer mentioned that there have been campaigns to allow euthanasia to be available to anyone over the age of 70. Boer's studies show that euthanasia is something that can easily go out of control, which is why he has changed his stance on this controversial topic.